Well, exactly 9:13 and 38 seconds. And right now I'm going to get that amazing gentleman live onto our restream. You'll be able to hear him. You'll be able to understand what exactly he's saying. But right now, a warm welcome to Dr. Javed Akhtar on our restream. And hold on, sir, while I just Yes, I hope you can hear me loud and clear. Sir, I cannot hear you. I cannot hear you yet, sir. I think your mic is not on. Can't hear you. Maybe you can just take off your mic and talk. Sir, you came on and again went off.
Okay, just
hold on, no problem. It happens. हो जाता है. कोई tension नहीं है.
Just a minute. So I'm so sorry.
Well, while Dr. Javed Akhtar is kind of getting his system in place, he's an amazing gentleman, and he is the Director East of Karkinos. And of course, Karkinos is basically screening for a healthy life, and they always say, let's talk about cancer. And let's not wait too much before talking about cancer. Let's talk fast.
Can you
Doctor,
hear me?
If you can say a big hi.
Can you hear me now?
Hello? No,
Hello?
I can't hear you
Can
still.
You hear me? Hello?
One sec, doctor. One sec. Now, doctor, say something.
Hello, can you hear me?
Yes, now I can hear you clearly. Great.
I'm sorry for the inconvenience.
No issues. You know, we are living in a high-tech digital world, and it does happen. You know, but the thing is that right now you are on a restream. Sir, your paper has come in front of the camera.
Thank you so I'm sorry.
Okay. But first of all, a warm welcome to you, Dr. Akhtar. Thank you so much for joining us. And
Very good evening to everyone. Very good evening to you, Mr. Tavi, and Ms. Jimmy, and thank you so much for having me on board.
No, it's really nice to have you with us. And of course, today the important thing is, Doctor, tell us a little bit about Karkinos, because you are heading the East, you're the Director East, and I've been told it's all about screening for a healthy life, and screening, you know, at an early stage than at a later stage. So how do we go about it? Suppose today I want to, you know, approach you all and say, listen, I just need to get checked up. You know, I'm feeling XYZ, you know, and I feel I may, you know, be undergoing some issues. So let us know, what is Karkinos all about, and how does one get into it, and how does one utilize the facilities, because there's an app and there's a lot of engagement available.
Right. So again, very good evening. Look, actually, you know, so I am Dr. Javed Akhtar. You know, I'm basically a radiation oncologist by profession. I have joined Carcinos Healthcare as Director of East, which includes the Northeast, and so Karkinos as a company, it is the first healthcare company where there is a joint stake, where Tata's and Reliance has a joint stake, as well as a host of very well-known national and international investors, including some very eminent doctors who've come forward and invested and formed this platform. Now, why this platform was made and what made me join Karkinos was that so it's been 18 long years since I've been practicing, and what I've seen is that most of the patients, they come at a much later stage. Cancer has 4 stages, so most of the patients, they come at a much later stage rather than coming at an early stage. So in spite of getting the best treatment, now we've got very advanced treatment. In spite of getting we've been only managed to increase the overall survival by a few months, and not more than that. So what we are generally looking at is to increase the survival. However, if a patient has come, there are many patients who've come early stage, wonders. There's been wonders where patient has been treated and they are doing absolutely fine. So this is where the thought process comes, that why not, with the increase in the number of cancer cases, why not catch them young? So this is where Karkinos comes, where the main aim of Karkinos would be to transform the cancer care landscape into through cancer awareness and early detection program. And it actually, what happens is, it's the core values of Karkinos and its strategies. It actually aligns to the United Nations Sustainable Development Programs, like the goals 1, 3, 5, and 10. They also look into the same manner. So this
It's
is Carcinos in a brief, and
amazing, amazing. Hats off to you guys. But tell me, cancer is such an area which is all over the world. We don't know how it hits, when it hits, and how it hits. So, what kind of menace in terms of cancer is causing in the country, especially India?
well, it is actually a menace. Why? Because it's not about that cancer is something new. Cancer was always there, but the number of cases are increasing. Of course, due to various reasons, it is increasing. The more difficult part is that the India's cancer care system itself is so fragmented. It is actually disconnected. It is not not that it is not integrated in certain places, like in the Tata Memorial Hospital. Like you have an integrated system, but the more focus is on treatment rather than early diagnosis. Treatment is when you've already developed a cancer, but what we are actually focusing on is early diagnosis and screening, so that even if a person does not have cancer, or has a tendency, we are able to tell that patient and identify that patient and tell him, you please take care of yourself. So this is where the thought process comes from.
So,
WHO, has said that, so in one by 2030, 1 in 10 out of 1 in 10 person will be suffering from cancer in the entire lifetime.
this is very, very serious. Very, very serious. And we got a message, a great awareness on the menace of cancer, and kudos to Karkinos for the work they are doing. Amazing. So tell me, Karkinos and its genesis, why have you all just got into, I know there are a lot of areas, where people need a lot of support and help. Why in this particular area in such a big way? And it's like speciality or specialists in this particular field of cancer, where you'll want to purely work in this area. What is the genesis? What are the thought
Yes.
behind it?
So actually, I'll tell you. So Carcinos is actually, it's a healthcare platform, which is a purpose-driven healthcare. What we say, purpose-driven healthcare technology platform, which provides end-to-end cancer care in a more holistic manner with the technology first approach. Now I'll explain. These are big terms which I've said, but I'll explain it. So our scope of work would, it range from, at one end of the spectrum would be risk assessment on a digital app, to screening, to early diagnosis, then a staging workup, and then treatment and palliative care. So we actually cater to the entire spectrum, not that we would cater mainly to the early diagnosis and screening. We cater to the entire spectrum, but our main focus would be screening, early diagnosis, and treatment. And how do we deliver this? We deliver this through our partner centers and partner hospitals, which we would call this a distributed cancer care network, DCCN,
Okay.
where the distribution would go down absolutely into the village and the block level. In a more of a hub and spoke model. We wouldn't want the patients to come all the way to the city to get treated. We would want affordable and excellence in care closer home. This is what we are looking at. So
So,
yeah.
so how do in terms of early detection, what do people have to do, or how do you all go about with it,
Yes.
so
So
that many people don't realize it till it's too late, or till it okay, we have a message. Dr. Sam Mitra, all the way from Thailand. He's saying, Jimmy, I work on terminal cancers, at Bangkok, and I think he's at Thailand right now. And I'm so happy. Your voice is engaging a lot of people, not just in the country, in Calcutta, but across the world. That's really great. So,
Thank
doctor, so how does how do you all go about with it? How do you all have that early detection? Because people don't realize it or don't know till it's too late. So
Yes,
how
very
does
true,
one go
very
about
true.
with it?
But the first message I would like to give you, is like, cancer is actually curable. Most of the cancer, I wouldn't say all cancers, but most of the cancers are curable if treated early. And 70% of the cases actually come in stage 2, 3, 4, mostly in 3, 4. So that is what we are looking at. That is, we want to reduce that burden. So what this Karkinos does is it actually endeavors to provide world class care. As I said, excellence in care closer home. You know its main purpose would be, so as I told you earlier, it is a purpose driven platform. So the purpose would be to reduce the cancer burden, improve the 5 year survival rate. In cancer, we talk about 5 year survival rate rather than complete cure. So improve the 5 year survival rate. So this would be the purpose. And how do you do it? You make cancer care affordable and accessible as much as possible closer to your home. And so how do we do it? We are trying to transform the people's behavior from illness to wellness to proactive periodical screening. And this is what we are looking at, especially in cancers which are very prevalent, like the oral, lung, colorectal cancers, and in case of males, prostate, and in case of breast, cervical, and breast cancers. So this is what we are actually looking at.
So I just want to know, suppose if someone wants to get themselves checked up, or they may not have anything at all, but they just want to do a diagnosis. How do they go about with it?
Yeah, so Karkinos has got it's an amazing platform. So what it does is, the first step would be risk assessment. So what is risk assessment? At as of today, no one would be at no risk. There would either be a person who's at an elevated risk or a lower risk. But elevated risk actually doesn't mean you have cancer. It's just that you have an elevated risk towards cancer.
Getting
So,
cancer, whatever.
so how do we do this? So Karkinos has developed, it has developed an Karkinos app.
Okay.
It is which can easily be downloaded. It is a free risk assessment app, which is developed clinically. It is not that I have developed it or someone else. It's a very clinically developed app. It's a questionnaire of 20 to 22 questions, especially for those 6 kind of cancers which I've just spoken about, and it just takes 10 minutes. You just need to fill up that app, and a result comes to you that you may be having an elevated risk, or you may be having a lower risk. Lower risk we usually do not say, but elevated risk we have to be. So what happens is, we've got partners who go out into the general population. We go out into the general population. If it is rural, we go out into the villages, the blocks, the subdivisions, and if it is urban, we go out into the general part. So everyone, not it is not only rural, urban, everyone should use this app, should download this app. And once this you've undertaken this risk assessment, so through, we've got a chain called a command center. This is something very, very unique to Karkinos, where we've got people called care mitras who would be, navigating this patient. So if there is a person with an elevated risk, this care mitra would call that person and tell that person that you need to go to a partner. We've got partner centers even at block and subdivision level, where you need to go and get yourself screened by a general physician and not an oncologist, because you do not have a cancer. You get yourself screened. There are screening protocols, well-defined screening protocols. So you get yourself screened, and once the screening is done, it is then from there you go further up. I really wouldn't want to go further up. The need of the hour is screening, so I would limit myself to this, Karkinos app, which I would urge the people to download and get their pre-screening done.
So when people download and they actually get into the app and they have the elevator, you already said that you'll go out.
Yes.
So tell me one thing is, uh, this screening, you feel it really helps in the early detection of cancer, the importance of the screening?
Oh, yes, it does. It actually does. It is very important because, more than half of the cancers can be diagnosed at a very early stage. So, screening is something which is very low cost. It is not a very high cost, and is actually a step before diagnostic intervention. So screening can be, it can be made easily available and up to, even up to the grassroots level. Everyone need not spend, huge amounts in diagnosis, without the need. Nowadays it's become a trend where, you have a problem, you go and get a CT scan done. Not done, not actually required.
Right.
There are enough and more methods where you could actually get yourself, checked at very close to your place through various screening methods. So once that screening is done, people in villages, people, urban poor, who have low resources, they do not, it's difficult from there to access, such costly diagnostics. So for them, screening is very, very important. You detect these people with the detecting these people at elevated risk and providing them with screening services. It actually helps them, get detected early. And we have this through our Karkinos, platform.
This is truly amazing. Generally when people kind of get the fear of cancer, or they've been told they're very worried because to everybody cancer, oh God, I'll have to spend lakhs and lakhs and lakhs of rupees. I mean, that's the fear. So even I know some people who feel uneasy or feel there's some kind of thing, they don't even want to go forward because first thing they say is यार 20-25 लाख रुपया खर्चा हो जाएगा
Very
तो
true.
let's forget about it, जो होना है सो होगा. Lot of people have this fear, and trust me, there are a lot of people, when you look at various chemotherapies, this, that, and a whole lot of stuff, lakhs and lakhs are spent. So there are a lot of people out there who may not even want to go forward, worried कि यार यदि ठीक है अर्ली डिटेक्शन में करवा लिया, but by chance, God forbid, कुछ हो गया, तो how will I afford it? What is your thought on that?
No. So our main intention. So there is it. The main intention is that if you catch them young, if the cost is actually very low. The treatment cost is actually very low. So if you're treating a patient in stage 3 and stage 4 disease, it is 3 times actually what you treat in a patient of
Okay.
stage 1 and stage 2 disease.
I've
So that
I've
is
been
the
told. I've been told. I was reading a little bit of literature in Karkinos, the pamphlet, and I was
right.
told that someone in stage one, the cost was only 1.2 lakhs, and within 7 to 10 days, he was also discharged.
Yes, absolutely. So, in early stages, you don't need all the three. In early stages, you don't need all the three methods. So in cancer, we've got radiotherapy, chemotherapy, and surgery. So in early stage, you could just go ahead with the surgery, or you just go ahead with simple radiation if it's a vocal cord cancer. And you're absolutely cured. I can show you so many people
Wow.
who've been absolutely cured.
I'm so
And
happy. I'm so happy I'm talking to you because I always thought, that cancer, oh God, khatam ho gaya, life
Nahin,
khatam
nahin,
ho
not at
gaya.
all, not at all. In fact, so there lies it. The need of the hour is a proactive wellness approach towards cancer, and
Great.
actually, Carcinos is providing this through early detection. The program, so it provides a more wider and faster approach.
Just let me put it this way. You definitely would encourage everybody to download the app. Take that test,
Absolutely
which doesn't involve anything. Just answer the questions, and
right,
and okay. Suppose it comes as high elevated, in
right.
the app. What do they do next?
So as I told you, we've got a command center. It's very unique. It's a very unique method where we've got those there's certain people called care mitras. So they would be calling up those people with elevated risk, and they would be telling them that, okay, you really don't need to get worried. We've got counselors, we've got everyone in this command center. So they would be assuaging the patient that, okay, nothing to get worried about. What you do is you need to get yourself screened. Elevated risk does not mean cancer. Elevated risk means you are at an elevated risk. You might have. So out of 100 elevated risk, maybe point 0.1 or point 0.2 would have cancer, something like that. Okay, so not that, but yes, the moment you see you have an elevated risk, you need to keep yourself under check. So if you're smoking a lot, you
So
cut
so
down your,
so this is amazing. You're so reassuring. You know,
yeah,
even I used to think, yaar, cancer hua to khatam. But you're
right,
so reassuring. Now tell me one thing. If I use the app, to use the app, of course, I enter my name, my details. So
right.
if it's elevated risk, you'll already get that information, and your care mitras get in touch. So do
Yes.
I have to go to any site, or it only happens via the app?
No, it is. So what you have to do is you have to go to the site and you just download the app. So
So
Carcinos
where
app is
where
there.
where what
So
site do they go to?
Carkinos.in. Carkinos.in.
Karkinos.in. This is truly amazing. I'm so happy I spoke to you today, because the dreaded cancer word is actually got me a little reassured. Ki, so what? You may have it, but there's nothing to get worried about. I think it's good to act quickly rather
It
than
is.
say, yaar, kuch nahi hai, chhod do, yaar, baad mein dekha jayega, and it develops. So, doctor, we have the world listening to you. We have the country listening to you. We have the state of Bengal listening to you. What message would you like to give to the people who are listening to you right now through the show?
Just one message. I would urge everyone to just download this Karkinos app and it's a free risk assessment. Nothing to get. There is nothing. No panic in that. Even if an elevated risk comes, but please do download the app. And also, I would urge them to urge their parents, their relatives, their friends, their neighbors to download the app. What would happen is through this, we might end up having, if supposing out of 100, maybe one person would get that help. It's something get got early, and maybe that patient wouldn't we wouldn't lose that patient. That's it. So
Okay,
this is something we have
this
to
is
find this curve. We have to fight this curve together. and
absolutely. Now, I
and I
just
would
want to.
thank Friends FM
No,
absolutely,
you're more than welcome. It's
for
such a
giving me
great
this
thing.
platform to
Now,
spread this
this is
awareness among
amazing.
the people.
So now I'm saying is, so right from the time when the care mitras get in touch, okay,
Yeah.
you all take it forward and advise the person to go, or they do it themselves.
No, so we navigate the entire process.
Brilliant,
So
brilliant.
and the entire process is navigated. It is so the first process is go and get a screening done by a general physician. Supposing through so most of the patients are filtered there. Not every or not all the elevated risks. So after that, if supposing there is something, so we ask the patient. So the care mitra again calls up the patient and says, you go to a partner investigation center, and there is a specialist there. You meet the specialist. The appointment is done for them. So the patient goes there and gets himself further assessed. It could be a scan. It could be through a specialist. And if it is required, a biopsy is done. Only once the biopsy is done, and if it is cancer proved, then only the patient is sent to an oncologist for further care.
Okay, now you're doing such amazing service, and I'm asking you a question. How do you sustain because an app, maintaining it, running it is a costly affair. It's not cheap. How do you all manage it?
So
There
that's it.
must be a charge. There must be something for the services, I'm sure.
Really not, really not.
Okay,
We
great.
are this risk assessment is absolutely free of cost.
Okay,
We are doing it out of our zeal. We are doing it out of
amazing.
uh, we want to reduce the risk of cancer burden. This late stage of cancer is something. There is this like-minded group which has actually come together to help this out.
Hats off, doctor. Hats off to all of you all, and of course, I mean, amazing. I think my appeal to all the listeners hearing me and people watching us on the digital platform. Please go to Karkinos.in. Download the app. There's nothing to worry about. Answer the basic questions, because who knows, you may actually early detect, or you may have nothing to worry about, because hota na, अरे यहाँ पे पेन हो रहा है, वहाँ पे पेन हो रहा है, पता नहीं यार, it could be cancer. So at least you have a mind का शांति.
Very true. Very
Secondly,
true.
if you have even
It gives a different feeling altogether. Okay,
absolutely, yeah,
something
it
else.
जैसे होता है ना, upset tummy, maybe tummy pain regularly, and we get worried. What's it? So the logic is at least and if God forbid if there's something, it's early detected. And as said, I've seen it. It's not expensive, early detection, and you get cured absolutely. I mean, there's
Absolutely.
rarity of rare cases which go a little haywire, but I think that's what amazing. And I think this is the only of its kind I've seen in the country, where you actually download an app and you fill in the questionnaire, and it gives you a low, elevated, whatever risk, and which you get in touch with the gentleman and then suggest a path of getting the person checked. Amazing. Doctor, thank you so much for joining us. This has
Thank you.
been such a wonderful insight, and not only just a great insight, but reassuring, to a lot of people who even dread taking the name, saying cancer, or worried ki yaar pata nahi, and they always scared if they're diagnosed. But I think if you are diagnosed right in the beginning, there are 99.9% chances that you'll live an absolute normal and healthy life. So,
I would,
doctor,
I would again thank Friends FM to help giving me this platform to send this
no, but
spread
doctor,
this message.
thank you so much. It was such a pleasure talking to you. God bless, and carry on rocking with this amazing concept. And I'm sure, once again, to everybody listening to me, Karkinos, KARKINOS.in. Go to that, download the app. Don't give it a thought. Download the app, and at your comfort zone, go through the questionnaire or answer the questions, and you may have a low risk. You'll be very happy. कोई टेंशन नहीं है. एक shot में. And if it's an elevated risk, there's no harm in getting yourself checked up. As doctor said, out of 100 people, maybe 100 with elevated risk may not have anything at all, or maybe one may have. So at least मन का शांति मिलता है कि I am not in that area. Yes, Karkinos Healthcare is the best. We have another message coming on, and this is truly awesome. Dr. Akhtar, thank you so much. It was such a pleasure talking to you and joining us, and really appreciate your kind words. Thank you. Take care, and all the best.
Thank you.
Well, that was Dr. Javed Akhtar, Director East of Karkinos. And hey, Calcutta, hey, world, and hey, everybody listening to us right now. It's important that we make a difference to ourselves. No cost to it. Just download the app and answer the questions, and you'll know where you stand. And hey, time for a short commercial break. Hold tight.